Yeah, I can record. In fact, I'm recording now, or it's
Perfect.
showing a recording. Looks like we're getting a good group here today. We'll just take another couple minutes to let others join, and then we'll kick off. All right, it looks like we're getting at least a quorum here, so why don't I go ahead and get us started. I'm John Fitzpatrick. I help organize these meetings on a monthly basis, and glad to have everyone along today. We have a little bit of a different topic today, and a little bit of a different format in terms of a little bit of a working session to try to make sure that we can put together a credible response to a challenge for doing augmented and virtual reality type solutions. It doesn't, in this challenge, it doesn't necessarily have to be health, but that seems to be a nice kind of a stepping off point for much of what we do. And so because we've seen creative ventures in this regard in the local area, we thought it would be something that we could be able to build upon as well. So we'll kind of turn things over a little bit to Aaron to describe the background of the challenge that we're facing. He might invite others in to discuss that as well, but maybe we'll just kind of kick it off quickly with a quick round the table here. Keith, you want to introduce yourself, please?
Keith Gary, Vice President of BioNexus KC.
Greg?
Greg Elliott, 1623 Farnham.
Liz?
Liz Cook from Children's Mercy Telemedicine.
Jay Edgar?
Jay Urbanich, Street Medicine KC.
You're looking different, Jay.
Yes.
Steve?
Steve Began, Lead Creative Technologist at Dimensional Innovations.
Aaron?
Aaron Deacon with KC Digital Drive.
Doug?
Doug Hohulun with Nokia.
Allison?
Allison Troutwine with Truman Medical Centers.
Larry?
Larry Heffling, I'm with ITS Strategic Consulting. Good morning.
Morning. Tex?
Tex Teixeira, T-Mobile.
Great. Teresa?
Teresa Gerard, Guardian Group, Health IT Consulting.
I'll go back to Jim. Jim?
Jim Sarsa of KC Digital Drive.
Okay, and we have someone on the line in a 402 area code. Could
yeah, John, that's Rich Burry,
Hi,
Healthcare
Rich.
Consulting in Omaha. I'm always on my phone since I'm multitasking here. Good morning, everyone.
Good morning. That's okay. Michael.
Yes. Hi. My name is Mike Lund, and I'm currently an e-scholar at UMKC working on an augmented reality venture.
Great. I think we had Greg C on here for a while. Greg, are you still with us? I think that was Greg Corpier. We'll see if he is able to rejoin us. Christine.
Hi, sorry I'm a little bit late and I'm going to be jumping probably on and off a little bit this morning, so
That's
I
okay.
apologize
That's okay.
in advance. I'm Christine Allman. I'm the Director of Visualization and Academy Operations with UNMC IXL.
University of Nebraska Medical Center.
I am.
Yes. Okay. Great. Thanks so much. Anurag.
Hi, my name is Anurag. I'm with Kansas City Digital Drive as well as founder of Helix Health.
Great. Craig. Craig, are you there with us? And Stan. Is that Stan Edlovich? Maybe even? Okay.
That's probably Craig Christensen from H4, John.
Yes, I'm assuming the same. So we've got one of the things that I'll note, as you may have seen as we've gone through here, we've got some representation from the Omaha area. We are looking forward to joining with partners in Omaha to address the challenge. And so hearty welcome to all our Omaha folks for joining us this morning, and we look forward to opportunities to work with you. With that, I guess I'll turn it over to Aaron.
Thanks, John. And good to see everybody. So as John mentioned, and for those of you who have been with us for a long time, we're kind of getting ready for a throwback next year to our hackathon days. For those of you who don't know, back 2013, 14, 15, we spent quite a bit of our resources and energy at Digital Drive around gigabit applications and how do we look for use cases for ultra high speed internet. We've continued to maintain that part of our portfolio. A lot of those ideas and projects kind of had their own maturity cycle, and so part of our energy has been helping them move further along that cycle, and we haven't done as much for, I'd say, the past couple of years of the really early stage innovation work. And we have an opportunity to get back into that. And so we're working on an augmented reality challenge event series through 2021. The rough outlines of this are to kind of announce the project in after the first of the year, continue to do work and sessions like this, reaching out both to the VR community. So Steve, Tex, Mike, a few others on here, are kind of enmeshed in the development and sort of understand the potential and the use cases for the tech and what it takes to build it out. And then also bringing them together with people from the stakeholder community. So we want to find users who actually need these tools. In this case, obviously it's healthcare specific, and this is the kind of things that surface regularly within this group. I think we had I don't know, do you remember, John, when Trinity Animation presented? It's been at least 2 years. It's been, yeah, they came out of the Gigabit Community Fund work that we did with Mozilla. They had an anatomy virtual reality app that they did on Oculus, and we've done a little bit of outreach to the simulation lab at KU, the mixed reality lab over at Central Missouri. So it's really kind of bringing the two sides of the equation together, the tech experts and the users. We're also looking at some education and workforce development apps, potentially some applications in the design, construction, and engineering space. And we think between those topics, we'll be able to help incubate some potential applications over the next year. And really, for our purposes, we want to see things that have a social impact. So healthcare, education, workforce, things like that are kind of where we focus. So the rough contours of the event, as I say, over the next couple months, we will be doing some ideation and just kind of community building and idea generating sessions, looking to target in on what seem like a few promising application areas. And those can be things that are, brand new and really from the ground up, to things that, maybe have a demonstrated need out in the marketplace, or maybe are in early stage concept development. Doesn't matter too much to us what that development stage is, but still pretty early. And we're going to be working towards a design discovery workshop in March. So the idea will be to take what are really a series of pretty informal brainstorming events and put them into something a little bit more structured. So we'd like to come out of our March event with a handful of sort of defined project canvases. They might not be complete, but they at least have an idea articulated, a user base, at least a thought to a business model, not from an entrepreneurial standpoint necessarily that someone's going to go out and create a new business, but does it actually have users and a way to support the work being done? Kind of a stress test on the viability of an idea. The idea is that, and we're still in sort of sponsorship seeking and fundraising stage for this, but the idea is that out of that March event, we've got at least 3 ideas that we can award some further development money to. So the parameters around which we're targeting this, we're trying to get $3,000 each for those top 3 ideas. We'll put a judging team together. We haven't quite decided if those will be divided by subject area. So we could do one healthcare, one education, one engineering focus. They could all 3 be healthcare if we think those are the three strongest ideas. But the idea behind that money is to give the team some incentive to take their idea to the next step. And we think sort of the next step will be what we're calling a hackathon in May. It may end up more like a design sprint or even a reverse pitch. The idea between March and May is to take what we expect will be the seed of an idea and really kind of frame it out into a little bit more substantive project canvas and put together a development sprint plan, so that when we kind of reconvene the group back in May, we've got a chance to really hit the ground running. And do some meaningful work, hopefully some build work, so that we can get at least a very early stage prototype produced in May. And after that, we'll have the 3,000 that's given to the 3 kind of strongest teams out of the March event. Our hope is that other teams continue to work, so it's not like it's all over if you're not one of those top 3. And then during the May hack event, you'll get to build out again your. I don't know how far it'll be, but however far you can take it towards a prototype, and we're hoping to have 2 prizes after that: a $15,000 first prize and a $10,000 second prize that are awarded then, with the idea that over the next 3 months between May and August, you can really build out an MVP or an actual sort of more mature prototype. Do a demo day in August, and then that would conclude kind of the trajectory of this event series. We're working with a number of other partners about how we would take what should be a pretty well vetted prototype, have some significant development resources behind it, have done some work with kind of product market fit and making sure that we've got real users, then by August or September, and move that into whatever the next stage of the kind of business development cycle would be. So, again, that could be a brand new startup and a new company. It could be an existing company that's wanting to build out a product line. It could even be a healthcare institution who wants to develop something in-house. We're pretty flexible as to what the model looks like, but the hope is that by Q4 of 2021, we've got a couple impactful AR/VR applications that don't exist right now. So let me pause there for a minute and see if there are questions. Okay.
Aaron, is the thought too, doesn't the Facebook Reality Labs have like a national competition? And
Yeah. So the follow-on piece of this and what has spurred this is our partnership with US Ignite, who we partnered with on our gigabit hackathons of yore, and have seen a lot of good ideas and companies come out of that process, both in Kansas City and nationally. They are sponsoring this in 3 cities over the next year. Each city's the way they do it may look a little bit different. They have partnered with Facebook Reality Labs, so there is definitely an interest on Facebook's side of seeing Oculus apps come out of this, and opportunities for teams both to get in front of the Oculus team. There is a possibility certainly of visibility within kind of the Facebook ecosystem. I think they're hoping to see apps come out of this at a national scale that get on the main stage at some of their events and conferences. And the other thing that US Ignite and Facebook together bring to the table is the potential for a $20,000 prize match. So our prize tiers and how we've kind of thought about this and designed the sponsorship parameters have leveraged the idea of being able to bring in $20,000 from outside the market. We don't know if we'll get that. That will be competitive. We've got a pretty good track record with US Ignite and are doing another air quality sensor project with them right now. I don't know if that will help or hurt us because they may want to spread their resources around. And we think there's enough interest and just within the Kansas City and Omaha areas in the project to take it forward, whether we get that or not. But obviously, if we get an extra $20,000, we're thinking that the whole budget for the project is probably about $60,000. Obviously, more sponsorship is great, but if we can raise 60, then we can do it, I think, with or without the US Ignite money. So that's our goal. Sorry, if we raise 40, then that'll be 60 if we get the US Ignite money, and if we don't get the US Ignite money, we'll still have enough to do it. The prize amounts may shift a little bit, but the national visibility, US Ignite has run an accelerator program. Honorog's company had gone through that a couple of years ago. A couple other KC companies have gone through that. I think Big Bang with Jonathan Wagner and Tim Sylvester and Integrated Roadways went through some of their programming. So they've got a number of assets that can help companies that go through this, and it's a good community to be associated with.
Aaron, can you expand on the connections to Omaha?
Yeah. So this was accidental is not quite the right word, but Greg Elliott, who is on our board and has been involved with our work for a very long time, used to be at 1102 Grand here in Kansas City, worked with Nova 8 Ventures for a while, and had a couple other stops, and has recently, 6 months ago?
6 months ago, moved up to, well, I'm still living in Kansas City, but work with the Carrier Hotel, main hub for the internet in Omaha. And so I thought it would be a good opportunity to get just seeing the cool things going on in Omaha to join the two markets together and make it more of a regional type of approach.
So the reason I asked was there's a couple of connections to Omaha that could be useful. There has been probably for 5 or 6 years a group called the Heartland Civic Collaborative that have really been looking at opportunities among Omaha, Des Moines, St. Louis, and Kansas City. And I suspect there may be some connections there that could be leveraged to gain some insights into what might be available. Another one that probably is seems a little quirky, but I serve on the board of the Mid-America chapter of the ALS Association, and Omaha is in our geography. So we have an advisory committee up in Omaha that is comprised of business and civic folks. And again, just being able to leverage that to get some insights. You may have the bases covered, but just put those assets on the table.
That's great.
Yeah, no, that's awesome. I think, it's Greg had the idea kind of early on, and I think it's interesting, the idea of, having facilities like 1102 Grand and 1623 Farnham, and how we can connect those, and the ability to really do distance high bandwidth applications has been an interesting focus. I mean, I think the last hackathon we did actually was the Gig Hacks, which was done in partnership with Chattanooga and Burlington, Vermont. And we, had extensive middle mile connections that were opened up so that we could do things city to city. Charlotte, I think, maybe was in that too. So yeah, I think it was a pretty exciting idea when Greg brought it. And then we just had our first meeting with Christine, Mark Norman and Megan Skiles, I think, from the chamber, and someone from the community college. Christine, you may want to talk just a little bit about the IXL Center if this is a time that you don't need to jump off and you've got a few minutes.
I
think
have
this
a few minutes.
group would like to hear that.
So I welcome everyone. I'll put it in the chat of kind of our website and kind of what we do. We are I would say a multi-dimensional and disciplinary simulation center on the UNMC campus, with our partner being Nebraska Medicine and the Global Health Security, which is, we're kind of known for being the people that handle the super infectious things. We, as a simulation center, handle the training for those people to go out and deal with all those super infectious things. We have 3 different floors in our building, and they kind of work together, but they're all kind of separate. This floor, and I say that because I'm actually in the office today, is all visualization. So we do AR, VR content, as well as holographic productions, and some holographic work with UNO. Second floor is more of the high fidelity mannequins. Standard, when you think of simulation, that's on that floor. The third floor is surgical skills, which is fresh cadaveric tissue and other tissue samples that kind of are for those, we call it the finishing school, I guess you could call it, because that's where you go and work on actual parts. I avoid that floor on principle. But the nice thing is, like, we kind of say, like, you work through this center as you are a medical student or nursing student. Our floor is where you can do things in AR, VR. We have a 5-sided cave. They hear lectures in the holographic theater. Our faculty love to see themselves in holographic form, and it is really nice for the students because we can augment that with different assets that we've created. We have a very small but efficient and mighty team of designers. So we have a medical illustrator, graphic artist, animator, modeling, like rendering, programming, obviously. So we kind of have like the whole gamut here to kind of create a lot of things in-house. We tried to purchase a lot of things off the shelf, but we found that they were not as medically accurate, or we couldn't kind of suit them to our needs, so we kind of had to build their own. We also have a small academy in our building that teaches AR, VR creation. It's called the VR Innovation Academy. We're kind of in a rebranding / refocusing time, just because lovely COVID kind of took our model, which was a 11-month program. You come in and you learn a little bit about everything, and then you spend the last piece kind of applying it in actual technology. Obviously, we had to go completely remote, and I hated it, and I just felt like it wasn't what it intended to be. So we're in the process of kind of retooling that, and we're kind of in collaboration with some partners at Stratcom and UNO to kind of create a very hybrid program that helps with workforce development here in Omaha. It pretty much covers IXL. We have a wonderful fly through of our building, and I will put that in the chat here in a second so you guys can check that out. The original intention of this building was to host a bunch of things. Obviously, we cannot host much. We do a lot of productions here now, which was something I never wanted to do, but that's what we do. We have a lot of webinars and a lot of different things. We have one tonight where, so we kind of take what we have and use it in ways that are productive. If you guys have any questions, I think, well, Greg has my contact information, but it's also on the website. So if I do have to jump off here in like 4 minutes, but I just have to check in with the team, and I'll probably try to jump back on as much as I can. We love collaborations like this. We love to see what other people are doing. We like to see, where we can help and in what capacity. We have a lot of subject matter experts across, I say it's across the street because that's where the medical college is and the hospital, and they work with us on every single project. So keep that in mind if you're struggling to find a subject matter expert. If it's healthcare related, we can probably find something, or someone, I should say. But thanks for having me today. I'm glad I could.
That's awesome. Thank you, Christine. And I think what I'd like to spend our next hour or so that we've got doing is first kind of go around and have, I know what a handful of you are doing, and kind of just get people to similarly share either on the healthcare side or more on the tech VR side. So probably Tex, Jeff and Steve, I will call on you guys to kind of talk about what your organization's doing from the tech side of things, and Doug, and then Allison and Liz from the hospital side and kind of in the telehealth space, and Robert, to talk a little about what kind of projects you guys may have going on in this space or what your thoughts are. So I'm giving you all a heads up that I'll call on you, but others that are working in this space, Michael, Teresa, be interested to hear what you've seen. Would love others to chime in. So feel free to post stuff in the chat. I can call on you, but kind of like to spend a little bit of time doing round robin. We'll see how long that takes to kind of get just people's experience and updates, and then spend a little bit of time at the back end of the hour to do some brainstorming on what kind of needs we see that are out there, what are opportunities where we might look to cultivate some project teams. Does that sound good to everybody?
Yeah,
Okay.
Great. I'll jump in. This is Teresa, and kind of share what I've experienced the last couple of years anyway in this space. As you may know, with COVID-19, they're predicting the next pandemic to be in the behavioral health space. We're already seeing evidence of that. So I've worked with Turning Point, which is now part of the University of Kansas Health System, on their resilience program that they rolled out over the last 3 years in the state of Kansas. But piggybacking on that, a couple of years ago, I saw the Brave Mind virtual reality. That's for veterans with PTSD. And so that's coming out of Strong Mind, and I can post this in the chat as well. So they've been very successful with the PTSD treatment in the veteran space. Then in Kansas City, you may or may not know, KVC, which actually has a facility, and they house children and adolescents that have experienced trauma. So they've been using virtual reality as well, just locally. And so that would be another source for you to tap into. So I just wanted to share that out.
Awesome. Thank you, Teresa. Those are great tips. Tex, do you want to talk a little bit about what you're doing with KU and the nursing school and your 5G lab?
Yeah, sure. And sorry I can't turn on my video. I'm having Google Fiber challenges at my place here. Yeah, so a couple of things. One, obviously, we see 5G as a key player in bringing some of these solutions to kind of life and bringing these capabilities to the devices to be highly dispersed. We also see some challenges in the technology that barriers of entry is the device cost. So we look at it from a technology point of view. How do we partner with the device OEMs to kind of change the architecture of other contents delivered to the device, so it takes advantage of the 5G networks and obviously makes the devices less of a barrier of entry based on the price points. And there's some initiatives in that place. So associated with that, we are, technology is great, but technology for the sake of technology doesn't take us anywhere. So we are looking at different verticals, one of them being in the healthcare, and we're partnering with KU Med Nursing School. And we're focusing, have an initiative right now going on, focusing on the future of nursing, right? Obviously, nursing was impacted, now is highly impacted with COVID, and is, starts off from the training, introducing the technology to the nurses, but also just simple stuff that nurses would be able to do in the past. And while there's, spots here and there of VR and XR technology being used, is really scattered all over the place. And I think there's some, well, let's just say we're starting with the learnings to see exactly what the use cases should be, and then we'll come back to the technology and see how they can take advantage of the technology to help out. So that initiative that's going on right now is helping up a semester-long study. And the next session is obviously execution on some of those use cases that come out of the study. So.
Sorry. So when you say this is on I mean, it sounds like this is on a semester schedule. Kind of how do you work with a class, or are you working with a class of students to do a piece of the project, and then there will be a set of deliverables that go along with that?
Right now, well, we call it a sector collaboration. Obviously, we start with a customer in the real world space that has the problem, and then we take that problem to the university. Right now, the CDR, which is a KU as well, does the studies, and then the goal, the next step is to bring some of those students that did part of that study that we select to proceed into the next semester and look at executing on kind of the use cases in partnership with some of the startups and other companies that we will have the appropriate capabilities, right, to partner with to get it, to bring it to life, so to speak. So yeah, you broke up there a little bit, so hopefully I answered your question completely. But
yeah, I think so. So your customer in the real world space in this case is the KU nursing school?
Well, we spoke with Kansas Healthcare System and KU Med. KU Med happens to be we partner with because they gave us access not only into what they're doing today for training of nurses, but they gave us access into the nursing domain experts, right, that can tell us about the real world needs and kind of some of the obstacles they're encountering when they're doing their jobs. The nursing school was interesting to us, and we did partner with them because. Ultimately, you got to introduce the technology somehow, right? So training, to me, is the vehicle to get into technology introduced into the nursing culture, which, there's pockets that seem to be pretty open to new technology, but there's a lot of well-seasoned nurses that are not so open to some of the new technologies, right? So we're working through those and kind of understanding the dynamics and that culture.
And the students that are working on this, are they students in the nursing school that are doing that sort of needs analysis, or is it you said CDR? I think I'm not sure what that acronym was.
Well, yeah. So KU's got a section called the Center for Design and Research. They're not nursing students; they are just general students that take that class where they learn design thinking, etc. We don't have any nursing students that I'm aware in part of that class, but we have some that are interested in healthcare in field, so to speak, and study in that field. But the goal there is to kind of get a different perspective and them to be able to dig into the problem, right? So as they meet throughout the past semester, they've been meeting with nurses and experts across the domain, right? And then they're getting a good feel for understanding. Look, we'll see what the outcome is. We'll get a reading in about a week or so. But we've had some success in the past with robotics and things like that. Also, in this healthcare field that we did with Children's Mercy Hospital and things like that. So we'll see where things go. But yeah, at this point in time, this particular one is around nursing. However, nursing is not the only thing we focus on. It just happened to be the current initiative focus.
Got it. That's great. And it sounded like it was training of nurses specifically, not necessarily.
Well, we look at future nurses in general, right? But there's a training aspect to that, right? That if we're going to start introducing that into the nursing field, there's got to start somewhere, right? And training is a good starting point, and that's why we're partnering with the dean of the KU Med Nursing School. Right?
Great. Let's go to Steve. Are you still there? We'd love to hear kind of what DI's got going on in the VR AR space.
Yeah. So for those of you who don't know, Dimensional Innovations is a experienced design firm here in Kansas City. We're kind of separate from others in that we design, build, fabricate, and do all the tech for all of our installations as well. So we have like a whole manufacturing facility attached to our offices. And we do everything from like large scale 3D printing to software development. So a lot of the stuff that I've been working on is like for hospitals, arenas, museums, interactive installations. You know, like you'll see like those weird walls that you wave at and like particles go flying and things like that. That's a lot of stuff I work on. We've done a lot of stuff with VR and AR in the past, but mostly because of COVID, there's not as much demand right now that I'm seeing personally for AR applications. But previously, I worked at Pulse Design Group, a healthcare design firm in Kansas City, leading the VR and AR team there. We made a lot of VR and AR applications for different healthcare companies, Cardinal Health and Abbott being the two largest. So we've seen a lot of demand for training experiences, hands-on, pseudo hands-on simulations for complex surgeries. I learned way more about heart surgery than I thought I'd ever want to know about. And I've seen a lot of demand for just general data visualization tools using various headsets. I haven't seen any excellent executions for those yet, but I'm really excited to explore how data could be visualized in a 3D perspective using AR. So I've been around doing AR development for a few years now, and I'm involved with a lot of hackathons and a lot of different groups associated with it too.
Awesome. Thanks, Steve. It's interesting, you know, your comment on the data visualizations. The company Planet Impact, which is around sustainability and architecture, and that started in a process much like this, with an idea of visualizing civic data in early in the building design process. And the really early prototypes, even I think coming out of the hackathon, had, you know, like big bars growing up and kind of different visualization. That I think has pretty much fallen away from their product. I mean, they're still visualizing buildings, but there was definitely a VR component of that in the early stages, and it is really hard to do well, but certainly an interesting thing that people are looking for. Let's go to Jeff Danley at VMLYNR.
Hey, good morning. I appreciate the invite. So I'm trying to figure out where to start because our client base is so broad. I think very similar to what Steve just mentioned about their work at DI. We're similar. You know, our clients come to us with a variety of challenges. It's not all just marketing and advertising focused. It's you know, there's a lot of experiences. We do a lot of work with Ford around, you know, the vehicle ownership experience and creating, you know, everything from all of the in-dash displays on the new Mustang and Bronco to, you know, Ford Pass mobile application and some like Alexa skills and a variety of other technical solutions we deliver for them. In the AR and VR space, I'll offer two pretty diverse examples of some work that we've done for clients. We do all of this in-house. We've got roughly 8,000 employees literally around the world. And a lot of our AR is done here in the US. Our team in Poland also does quite a bit of AR work, as well as our team in Melbourne. But the first example, this is by far my most favorite example of virtual reality, a branded virtual reality experience. And this is something we did for a previous client, Gatorade. And it's a game called Beat the Blitz. But there is a pretty important strategy behind this. Gatorade was working with teen athletes, and they wanted to help educate those athletes on the effects of dehydration. And so we collaborated with the Gatorade Sports Science organization to, you know, learn about, you know, all of these effects of dehydration and how we could emulate those in a virtual reality experience. So that's what we did. We created this game. I believe it's still available out on Steam, large PC gaming platform. I've got a link to a video I can share with everyone. But so anyway, teen athletes can go into this experience, and it's like a football game. It kind of looks like the NFL Combine, and so you've got these football exercises that you have to do, some passing and evading oncoming defensive players. You're in the role of the quarterback, but as your dehydration, you see these lines in the background. They're large Gatorade bottles actually, and as the hydration level falls, you start experiencing dizziness and tunnel vision and all of these effects of dehydration. So what I really like about that one is we took actual science and we put that into this VR experience so that these athletes can see and feel what it's like to be dehydrated, so that hopefully when they're actually on the field and they start to experience these symptoms, they recognize that and they can take the appropriate action. So that's one example. Another example for augmented reality, this one's pretty interesting because it's an industry that really, most of our conversations are on more technical data and other types of solutions, but the client was United Rentals, and they wanted to explore AR to see what they could potentially do in the field to help their clients make sure they get the right equipment or recognize just size different objects and get the equipment they need on these job sites. So one of their most frequently rented pieces of equipment is a scissor lift for working indoors. Maybe you're painting a ceiling or changing lights or something like that. And I guess frequently people get the wrong size scissor lift, or to make sure they can reach what they need to reach, they just get the biggest one available and they're spending money that they don't need to spend. So this application we created lets you look at the room through the lens of your phone, and we will measure the wall and determine how tall the ceiling is. And then you actually place that piece of equipment in augmented reality, and it's to scale in the room. So you can see, is it going to reach high enough? Are you trying to reach up the side of a building or get up to the lights on the inside? And anyway, so you can place that equipment and see if it will reach. So that's one example. There was another one very similar for renting. I think it's like backhoe equipment. If you're doing trench work through the lens of your phone, you could analyze the trench or the area that needs to be trenched, and then you can it measures all of that space, and then just helps you select the right piece of equipment. One more I'll throw out in the AR space. Another interesting client. This was with Sherwin-Williams, and this was also using augmented reality. And again, we were using this not to visualize something in the room, but really more to take measurements. And you can slowly scan around the interior of a room, and the application will determine the size of the room. And this is really more of a project management tool. It would determine the space that you need to paint, and it would recommend how much paint you need for that space. And maybe you're tracking progress, and it could determine how much has been painted, how much more paint do you need to complete the project. So that one was pretty interesting as well. So that's some examples of the work in the pharma space. We're doing quite a bit of work with some of our largest pharma clients are Merck, Pfizer, GSK. There's a few others, but I did hear just a little bit ago someone mentioned education, and both patient education as well as physician education. And we've got quite a few requests, or several anyway, from those clients, and we're currently evaluating opportunities to create solutions in that space. I don't know if it's going to end up being an augmented reality solution or potentially virtual reality. we kind of lean more towards the AR space just because pretty much everyone has a smartphone. So there's something that we can deliver to them as long as the experience is right and it delivers the right level of education. I think that's the way we would lean. Let's see. Yeah, non-pharma clients, Ford. I mentioned Ford earlier. We've got some VR concepts we're working on for Ford. Trying to remember who else we've got, but that's looking at this space. But it's I think in a COVID world that we're all living in, with everything being virtual, with events coming up like CES, we've got clients that are trying to figure out how do we showcase these, new products and, bring people together in a virtual workspace or a virtual networking space. So we're constantly evaluating new solutions and opportunities to create experiences in AR and VR.
I'm interested, on the Ford comment. Do you find your work is thinking about VR, AR experiences in the vehicle for the customer, or is it more helping the designers of the vehicle experience using AR, VR tools to sort of imagine what different prototypes or ideas might look like?
It is all over the board. So everything from, there were early conversations about unveiling the new Bronco in augmented reality, right? So before the launch, or maybe to coincide with the launch, obviously this did not happen, but we had some prototypes built, and it was definitely a hot topic of conversation. But you could select, what trim level you want and what color you want, and you could place that vehicle in your driveway. And then you tie that to a social media campaign and get people to share out, I ordered my new Bronco. This is what it's going to look like in January or whenever they arrive. So that was one concept. Everything was consumer focused, not really so much for the designers. There was also, I don't even know if this one might actually still be alive, but and we've seen some other auto manufacturers do something similar. But help customers navigate the dash panel. Like if you don't know what the buttons do, or maybe you've got a check engine light or some kind of a code on your dash, again, through the lens of your phone, augmented reality could, the computer vision component could look at the dash and recognize where everything's at. And then in this AR view on your mobile device, you could tap on certain elements of your dash, and then it would display information about, whatever, how do you set the clock or program the radio or whatever it might be. But yeah, pretty much everything consumer focused. Great.
That's a great update. Thank you.
Yeah, sure.
Let's switch to some more health specific applications. Let's go, Liz. Are you guys using VR or AR applications at Children's, or exploring ideas?
We are not. Since the pandemic kind of shifted things around for us, we have gone from, like 35 specialties practicing telemedicine via facilitated visits at our outreach centers to seeing patients at home. And non-facilitated visits, obviously, and over 50 specialties now are, using telemedicine. All of our providers, over 700 of them are now credentialed and using telemedicine. So that has been our world for the past 9 months, 8 months. So I know that Dr. Hoffman's team in research was exploring it, but we obviously had to take a pause because of the pandemic. So,
well, it's interesting. I mean, how much the pandemic has accelerated just sort of old school telemedicine, for lack of a better word, and has sort of legitimized that, I think, in a lot of ways, and even within the payer structure system. are there places that you've seen just as you've sort of watched that normalize somewhat, where you think VR or AR applications are a kind of natural next step? I mean, even though it's not obviously right on the immediate need because you've just got so much to do, but it's like, oh, well, now that we're getting people used to this thing, kind of here's what's next.
You know, it's interesting, like Teresa said earlier, that, you know, behavioral health, I think that is, that might be the spot to start with, because they, you know, there's a lot of teenagers, and especially now, I mean, it's only getting worse with, you know, the behavioral health needs of kids, with having to stay home and not be in school or etc. So I think that might be kind of a natural fit. I'm not sure exactly how that would work, but they, their team actually was the first big specialty to change our platform of the telemedicine, or of how we were seeing our kids. So we were using Microsoft Teams, and then we switched over to our InTouch platform in using it. And it's a much easier platform to use for patients and families, as well as our providers. So that might be more of a natural fit. I'm not sure exactly how it would work, but.
Can you talk more about InTouch? I don't know that platform.
Teladoc. I don't know if Teladoc is,
Yep.
Okay, so they bought InTouch.
Okay. What is better about that interface?
It is, so we can integrate our EMR through it, and the scheduling piece, although we still have to schedule in Cerner, the link gets sent out with reminders in a text message, and they don't have to dig through their email. So let's say that an appointment was made 3 months ago. They're trying to dig through their email to find that link to join the Teams meeting. And oftentimes they can't find it. So they call the clinic and try to get somebody to resend it. You know, this link is literally pushed out to them 10 minutes before the appointment. Again, it can be, you know, it can be pushed out however often we want it to, but at least 10 minutes before the meeting, they have that link, and they're able to just boom, join, and you don't have to download Teams or, you know, get the app. You know, it's just all very, very easy.
Cool. Allison, what are you guys seeing at Truman? You're on mute.
Thank you. Like Liz, I would say that Truman had a quick adaptation to old school telemedicine, virtual visits, and for Truman, it was quick. And we continue to see utilization throughout our organization, but primarily behavioral health. And although I'm very interested in the conversation and what I'm learning today, I would say that I don't know if Truman is, to my knowledge, we're not using AR, VR at this time, and I'm not sure what the early option would be at Truman to use that. I'm still very concerned about just how we get our patients connected, and if they're interested in a virtual visit, how we make sure that they have Wi-Fi and a device to have that virtual visit. So that's something that, I mean, we're very early on in adapting to AR, VR. So I'm interested, but we don't have a lot to share at this time.
Yeah, no, that's good. How about Robert at KU?
Yeah, we're doing a lot of things. We use iPads and some different things, but not really doing any VR, AR. We really focus. We have $1 million SAMHSA grant, and then we're also that works with children throughout the state on trauma in those other areas. And of course, VR, AR has a lot of potential there. We've really spent, because of COVID, a lot of the stuff that we do in person, like child-adult relationship enhancement training and parent-child interaction therapy certification for local clinicians. We've really spent our time having to move that into a virtual format, and there's a lot of potential with VR, AR there, because a lot of that involves role playing and working on positive behavior reinforcement and things like that. So a lot of interest, maybe sort of our next area, but I think like most people, COVID has made us really move into sort of the virtual format more in terms of the services we offer, and especially the education and training that we do. We've had to do so much of that, and but I think there's some real potential, and obviously in behavioral health, especially, there's some real potential to use it. I think we keep hearing that a lot, which is really interesting from so many of the people that have talked today. That especially in behavioral health, there seems to be some real potential here. But I'll be really honest, I haven't seen a lot of products. There's some studies that look at things like fears and persecution complexes and using the AR for that. But if anybody's got any apps or other things, I'd be interested in hearing it, because that's always an area that we'd be interested in both doing research and kind of putting into practical use. So
I think there are a couple products, and I'll try to put this in the chat later. I know Sarah Hill with Helium is the product name. Story Up, I think, was the name of the company, and they've got a VR product that, if I remember right, is designed to kind of help calm you before surgery, or in sort of in treating trauma. I don't know, John, if you've got a better recollection of exactly the use case for her product.
I see that being really used in mindfulness. Those apps for mindfulness, I think, are probably at the cutting edge of that, and certainly sort of the for-profit apps that we all know about and hear about, and people have hopefully made use of during COVID, with all the anxiety and other issues there. Yeah, it seems like that sphere, but I haven't seen it so much in a clinical sphere. I guess.
Mm-hmm. I think they did a pilot with Mayo, sort of it might have been pre-surgery, and had I don't know, I'll need to look up, see if I can find the study and see if that's real. I know that Bob Etzel, who presented a few years ago too on his iSocial work, and they're not doing anything with headsets or anything straight VR, but are doing autism spectrum disorder work, and have sort of these educational modules sort of in this behavioral health space that we've been talking about. Again, I think we'll try to get, I've reached out to both Sarah and Bob, and they're interested in support. They couldn't make it this morning, but there's a few apps out there, but it's interesting, I think, kind of reflecting on what Jeff said from the VML perspective. And I think, at least when I think, virtual reality or AR in healthcare, my first thought is towards sort of the virtual visit, because it's kind of the easiest thing to conceptualize. But this idea of, like when Jeff was talking about looking at your dashboard and thinking about how to read medical records, or how to read medical charts, or how to read medical, like there's an interesting, I'm curious if there's any work being done in helping patients understand the complex barrage of medical information that is thrown at them, because that seems like a little bit of a easier lift. You can do it with just a phone, not a headset. You can do sort of an explanatory overlay. Are there projects like that people know of in the healthcare space, or does that seem like an opportunity?
I'm not familiar with any like that, but it definitely seems like a huge opportunity, especially for even just like anatomy students. Like, you look down at your arm and you see like an overlay of the name of each bone in your arm and muscular structure, things like that. I've seen a lot of large enterprises try to push VR as a solution for that type of content when it really shouldn't be. For example, like, you put on the bucket on your head and you're barraging them with information that they should be writing down on a piece of paper so they remember it, but they can't because they're in a headset, and so they're not retaining any information. AR is definitely a better solution there, obviously, because you can pass through and have that persistent vision. But yeah, I haven't seen, I'd be curious if anyone else has, but I haven't seen any great use cases for that sort of approach in the past. But there's so much opportunity there.
Yeah, one comment I would have on that is, when smart glasses come out in the next 2 years, that's the expectation that, to Steve's point, it will, make it a lot easier for that training. And in fact, at Nokia, we're doing training on, digitizing cell sites as we're deploying hundreds of thousands of cell sites. And what we find is, digitizing it and then practicing in VR, or to get it right, like the digital twin concept, makes it much more, we're finding 30 to 50% improvement in cycle time by doing some of that. So bottom line is, I think some of that will happen as the technology of the devices, the headsets gets more simple. And I'm expecting that in the next 2 to 3 years. So we're laying the foundation, just like 5G and Wi-Fi 6 coming out, 6E, we'll lay that foundation. I'm real excited the next, especially 2 to 4 years in this space, that the devices won't be the limiting factors. The network won't be the limiting factors either. So, and then it's just about the applications.
Can you talk a little more about the training that you're doing on digitizing cell sites and the improved efficiencies that you're seeing?
Right.
Like, what does that mean?
Yeah. So bottom line is, they talk about the spatial web, or Web 3.0, where you basically digitize the physical environment. And so it's now spatially inside a digital environment. And like for Nokia, a couple areas we're doing is, one is like when, there's 400,000 cell sites in the United States, 440,000, and, they need to be upgraded to 5G, and then around the world, I think there's 7 million cell sites out there. So, you digitize what you're doing. So instead, the old way of doing things is you would climb up the tower, figure out what's going on, then climb back down. You may not have all your equipment, and you practice over, you might have 2 or 3 trips. So now what they do is actually they fly a drone, they digitize everything. They know exactly what they need to do. Then they in digital, in virtual environment, in the spatial web, you actually do the work, make sure everything's in practice. If you need to do education, it actually gives you step-by-step processes on how things can be done. And if there's people need to be trained, and then from that, then when you actually have to go do the work, it's a much simpler process. You only do it once instead of multiple times. So, in medicine, they're doing that as well, like surgeries where they digitize the patient. At first you don't succeed, don't do skydiving or surgery, right? You practice virtually first and digitize it, the spatial web, before it goes into the, do it in the real world. So that's going to be a big concept, I think, as well. One other thing I just want to make a comment on is, for telemedicine, in fact, there was an article that 41 million users use telemedicine this year, a growth of 100%. And that's expected to continue next year, like 20% growth. So, excited about telemedicine, just with, Zoom meetings or the iPad or whatever. But I see, again, when it becomes, you just put on your Apple glasses and you just see your doctor appears, and, makes it a much more enjoyable experience, I think could be very important. The other thing I want to talk about, you mentioned, is just the FCC has a $200 million program for telemedicine. They also have $10 billion, actually $16 billion auction going on in rural digital health, or excuse me, digital connections. So get broadband connections into the rural areas. So, money is being identified in these spaces. And I think in fact, U.S. Kansas City hospitals have been awarded some of the telemedicine grant funding. And, it will be interesting. In fact, I think this last stimulus bill, I saw another $10 billion for the stimulus. And so the question is what funding mechanisms are available? And is that an option for this group to help, identify and encourage the grant process as well?
John, did we ever hear back? Was it Excelsior Springs who got a big FCC telemedicine grant here, but we couldn't figure out what it was for?
Of the 200 million, 3 or 4 area institutions got them, ranging from tens of thousands for the FQHCs inside Kansas City to $1 million for Excelsior Springs. And we tried to engage them and had not really gotten any feedback from them.
So and is there a hospital in Excelsior Springs?
Yes, there is. And a clinic, I believe, as well.
Okay. Yeah, it would be interesting to find out if anyone ever gets a beat on what they're doing. That's an impressive number out of that.
Yeah, and considering that it needs to be spent by the end of the year as well, that's another big challenge for receiving a very big grant.
Though I think they just did an extension of the deadlines of the spending.
No, that's great news.
Yeah. See when they said, go ahead.
I'm curious, Liz or Robert or Christine, I don't know if you had joined back, Christine, but Doug was talking about the sort of surgery practice. And he was using the example, I think first, which I thought was a really good visual on Nokia's cell towers, where people used to have to go climb up the tower and, kind of see what was going down and then go back and get the right tools and maybe figure out if they need to rewire something they don't know how to wire. And now they send a drone up and they take a camera, shot, and they can do it all virtually in practice to really make the one trip up the tower more efficient. Are you guys in any of the hospitals seeing that sort of approach in surgery where you create the digital twin of a patient and have the doc actually practice in a virtual space?
Yes. Digital twinning is kind of a difficult, it's a kind of a dirty word for me because it's so difficult. But we do a lot of pre-planning, especially on difficult cases, using DICOM data, different sources of that nature. Probably our biggest use case is with Children's Hospital here in Omaha, because a lot of those cases are very complex and they're also very small, right? So looking at that pediatric heart in a 3D model, we've done those numerous times. We typically visualize them using 3D printing, which we don't do. We outsource all of that, but segmenting out all the data, putting it in a 3D print, as well as putting it on, we have CAD walls, as well as like Z spaces if we have to go mobile. So we like to practice in different ways as much as possible. I would say that we have a lot of interest in doing pre-case work on our surgical floor. It's a little harder because you have to kind of pre-order materials. So that makes it a little harder. So we want to experience as much on our floor as possible. And we're building our library to be able to do that in a very timely fashion. The whole digital twin of an actual patient, it's used a lot also in radiology and oncology. So they spend a lot of time walking through that in patient education. They've had to get a little creative with COVID, but they will take patient data, visualize that, and put that person through our machinery here in the cancer center, so they can visualize, especially for pediatrics and the family education piece. So I hope that answered your question. We also are big about filming everything that happens in our building for debrief. That's probably the biggest piece of our, one of the biggest selling points that we try to always ingrain into faculty and facilitators is that the situation can go on 1,000 different ways, but the most important piece is that debrief afterwards and doing that well, which a lot of people don't do well. You have to kind of teach them how to debrief. So we film everything using kind of cameras in our system. So all of the stuff within our building kind of talks to each other. So it's our drone of sorts. But it's I will say surgical planning is not where it needs to be yet to be 100% accurate.
Can you talk more about when you say the debrief is the most important? Can you expand on that?
So the big part of healthcare is medical errors. It's like the third leading cause of death in the United States. When you think about it that way, it's a big deal. And so it's teaching healthcare providers to speak to each other And so you experience it in the room, the scenario, whether it's a code or whatever it may be. And then afterwards you go into a room and you talk about what went well and you talk about what went wrong and what you can improve. And so we're building things in these cases out. And I like to kind of equate it to kind of, it's no different than what Huddle has done for sports performance. So you go and you look at your game, right? And you analyze your game tape and you go through that. It's not anything negative, which is something we've had to break down barriers in healthcare, is if you mess up here, you mess up here. Everything can be reset in our building. Like it can be redone. When you go across the street and you see an actual human being, you cannot repeat. So we go through those debrief process and it should be short and sweet. Like we learned our methods from military, like they're usually the simulation forefront, right? So we take what they've done and try to emulate that in a way that makes sense for healthcare.
Super interesting. Yeah, no, that's great. And one other question, you're when you say digital twin is a dirty word, is that because it's kind of creepy and weird and you don't want people thinking that you're making a digital copy of them, or is there something else that you're getting at?
Well, so it's one thing, it's really difficult, right? Because it's a lot of, if you want to have a true digital twin, you have to also use AI. We don't have AI yet in our building in a way that is useful. So, and maybe it's just a vernacular of what digital twin means to each other. So I am currently going through, with UNO is doing a great job, our University of Nebraska Omaha. Their innovation lab is amazing. And they're working with that in more like in robotics and teaching those robots on how to emulate a digital twin. And so we go through all these personality tests and you try to figure out what that person will say. But a lot of people, one, they don't like it. Two, they are very protective of their data, right? So using your sources and all of those things, it's very difficult to get through. And I will say it's not where it needs to be. So I am a case study for them because I don't care. Like I'm my programmer's worst nightmare because Jeff Bezos runs my entire household. So I'm probably the worst person to say, but so I went through the tests. I've given them all of my like Facebook data, all the things you can possibly imagine they have access to. And that thing, I will say it's maybe 15% accurate, maybe. So
interesting.
It just has a long way to go. I mean, that's just, and part of that is this is small potatoes, right? Like we're not Google, we're not there. So we're trying to do a lot more on that side, and it's more research focused than it is commercial focused.
Right. It's a lot easier to make a digital copy of a base station than it is of a human being's mind.
Correct. And I mean, even anatomy, right? Because you have to go through, like we have some Tesla data here that we use once in a while for different scenarios, right? Like we put it on our Sony wall out front because it's beautiful. But the average person doesn't go through that level of MRIs and everything to get your exact human anatomy. So little things, right? So if you get your appendix, or if there's different pieces within this that, for example, we're doing a educational thing on the Whipple surgery. And so there's so many pieces, like there's a standard 6 steps to it, but then there's the next 25 that they typically learn bedside. We want to take those and not learn those bedside. Same thing with cardiology, right? Most of those surgeons are learning on people. So it's all kind of it's a long ways from being 100% your person.
Right. Now, the other thing of virtual reality, I think that will help is just patient compliance, right? Like how do you help them to take their medicine when they need to do? Now it may, when you have a big headset that's clunky, a 2-hour battery life, that's not going to work. But if you have smart glasses and, it actually knows when you took your medication, and when you look at your medication and it scans the barcode of your medication and it sees you putting it in your mouth, right? And if you haven't taken it, when you put your glasses on, it will flash, you haven't taken your medication yet, please take it. I think patient compliant, like what the statistic is, I think 50% of people aren't compliant to their Medicaid, to their procedures, so I think that could be a huge area to help once the technology, once you have a virtual smart glasses that are all day battery life, so.
Yeah, just building on that, we've also looked at solutions, whether it's with smart glasses, which I'm a huge fan of, by the way, or through the lens of your phone, but using augmented reality particularly for the aging population, or really anyone that's got deteriorated vision. If you look at a pill bottle, with AR, we could blow up the text font size, right, and make it easier to read, or provide additional instructions for people that might not be able to read what's on the bottle, or just to help them understand the prescription.
I appreciate your optimism on patient compliance, but given the magnitude of the issue, I think it's going to be a bit more than a technology solution that's going to solve that issue. It's been ongoing so long. I think it certainly can help, but there's so many other human factors involved there.
Yeah, we kind of ran into a few of those as well when we did a pill sorting application for transplant patients. So transplant patients usually have like 20 pills. Previously, they taught them using like a candy, right? So you sort them and make sure you know how to fill your pill tray. So we put it using the Z space because we could move it between rooms. And they're like, oh, this is great. We can figure it out. We can be quote unquote compliant. But then you have to think about the number one reason people aren't compliant is because medicine is so expensive and they can't afford it. And so you kind of have to think through all of those pieces. And then if you can't afford it, how are they registering that? How are you finding it? And having that piece, I think, is, like you said, there's a lot of human factors that go beyond setting a reminder and making sure, but it might lead to asking those questions too.
Hey, Christine, we have a local company, I'm forgetting Liz's name, that has for transplant patients for kids, has kind of created a gamified thing to really help them, because as you said, following up on that medicine, everything else. I did want to share a personal experience. We're talking about the digital twin just from a patient perspective, not this. My brother actually had brain surgery, has had multiple brain surgeries. And for me, from coming in, that they did basically created a digital twin. As I said, for that, they will take the effort to do the MRIs and stuff. But from a patient side, it was really kind of reassuring. I mean, as I said, knowing my brothers were going to do this, they mapped out. You don't know what's inside the head until you get there. So them able to create that and map that out, and they talked through that whole process of doing that before they actually went in and did the surgery, I would say was really reassuring for us, as our families were going through that and everything else. So, I mean, I think there really is real world, benefits of that, of, the AR, maybe can be used to do that and do that better. I think it has tremendous patient impact.
I want to give, we've got about 10 minutes left, and Michael Lund, are you still there?
I am. Thanks, Aaron.
Would love to hear you weigh in on kind of what you're working on, both at UMKC, and it sounds like you've got a project that you've started.
Yeah, no. So, yeah. Hi, I'm currently in the UMKC e-Scholars program, which kind of acts as an accelerator of sorts for early stage ideas. I was accepted in with an idea that would use augmented reality to create multiple monitors, so you could connect it to your laptop and you can immediately have 3, 4, 5 extra monitors right up to use. We initially got in with that idea, pivoted to start looking at how we could use this in education and healthcare. And to make it really quick, we've been doing customer discovery. I've spoken with educators across the city, and I believe that there is use cases here with AR and VR within the city. Also, I believe that there's a common link here, because you guys have mentioned a lot about the behavioral aspect of healthcare. What I've seen a lot with speaking with educators is the social side of things is huge for them as well. There's a big need for that. There's a big need for creating, because again, COVID, they lost kind of that ability to have that social connection. So I do think that there's a common thread that say that social with education and with healthcare can be there to improve just the outcomes of every individual who is able to use these technologies. But for now, right now, what I'm in my project's in the customer discovery phase, or the discovery phase, to kind of understand where we're at. And healthcare wise, we pivoted about 2 months ago, started speaking with educators, now kind of starting to work with and speak with as many healthcare people within the healthcare industry as we can. Obviously been a little more difficult because of the COVID and the time of the year to get those people to speak. But at this point, I do believe there's a common thread that can be used across education and healthcare to improve the outcomes of every individual.
Awesome. Thank you. Thank you for sharing that. So I'm interested if we've covered, I think, a lot of good ideas. I think we've done a pretty good job of coming up with some use cases and needs. I would love to know, as you kind of think through who in the Kansas City or Omaha, which I'm less familiar with, ecosystems is working on projects that would be relevant to this conversation. And I'll kind of go through, and our AR challenge planning team has come up with a couple lists. So I'll run through here, but would love to kind of know who you're missing or who we're missing. So from the and some of these we've talked about, but I'm just going to kind of go through the list. So from a healthcare entrepreneur startup standpoint, we've talked about Trinity Animations, Mozilla Project, iSocial, and Bob Etzel, Sarah Hill, and Helium. Outside of the healthcare space, I know Epigraph, Tesseract, and Cambrian are both all doing projects in this space. So that's kind of my short startup list. From an institutional stakeholder list, we've been in touch with Matthew Lineberry, who runs the simulation lab at KU. I think Liz mentioned Mark Hoffman and the VR AR group that was at Children's. We've talked to John Rochelle and Chris Wilson at KU also. I've got In Touch Solutions on my list, although I haven't talked to anyone there. I'm curious, Jeff, if you know if they were in this space. And then Kansas City University, we've got on our list, but haven't talked to. Cerner, Stowers, MRI Global are possibilities, but not sure if there's active projects there. And then Wichita State and Central Missouri, both on the educational side, are other players. There are a bunch of other industries as well, but sort of as I read through that list, are there either individuals or organizations that you think, oh, yeah, this, if you've got that list, this is what we're missing?
Aaron, hi, Jay. This has been a great conversation. We primarily provide services to the homeless and the poor, but I can tell you that our mental health services are really questioning why people can't engage on that part. So the VR AR part, I know nothing about, but I know there's a talk with my team on that. Now, when it comes to the 40 medical students that we have in our medical team that are there 3 times a week, we are open to be used as guinea pigs to be tested for what you folks out there may want to use this for. So I'm throwing it out there.
That's awesome. Can you talk a little bit more about what that means, just as a resource, so people who might want a test bed of guinea pigs know what they're getting into?
Right. So we run a free clinic here just in the last couple of months. And so on Saturdays, we're probably seeing about 25 people, and we do more concierge medicine, kind of wrap around individuals from the prescriptions to the housing, et cetera. So every individual not only has a behavioral health therapist and a medical professional and a social worker attached to them working specifically. So our numbers are, we usually see about 25. There's a team of about 60 of us working with just 25 to 30 people to get the job done. So what I'm saying is this, is that we have a large pool of medical students, practicum students that are LPCs and and MSWs, as well as our volunteer staff and staff that would be open to be used for research, data collection, etc.
Awesome. Thank you. Other thoughts, people, or resources that that folks want to share?
One thing that I think we probably ought to mention, Aaron, is that for those who have in their own organization, a little bit like what Jay just indicated, but also those who may have partners that they work with in business or whatever, that the sponsorships here can also be in kind. And so there may be those physical resources or something that they might make available to this, and that would contribute toward the overall process as well. So as this larger team here on the phone with or on the online with us now is able to think through partners, that sort of partnership is very welcome as well.
Yeah, great call out. Absolutely.
Hey, Aaron, quick question for you. So a couple different AR, VR people within the city. I know you mentioned University of Kansas City. There's an AR, VR center that just got created at UMKC. It's relatively new. It just opened. I think that obviously that's a tool that could be used. I know I spoke with Jim a couple weeks ago, and he mentioned that you guys had reached out to the meetup group. There's a pretty diverse and large meetup group in Kansas City that uses AR and VR that just kind of discusses it on a monthly basis. And one of the leaders of that has a company or started a company named VR Rocks. And I think Rohit is, and I actually talked to him yesterday. I was hoping he could be on this call, but he or reached out to him yesterday. But I think all those people are really good in the environment or in the areas, and they can really contribute a lot if they get their hands on this.
Yeah, no, I appreciate that call out. And we have Rohit has been on our few planning calls, and Joel Stevens and Andrew London and a couple of the other colleagues. So I'm glad you reminded me of that. And we did, I think, I can't remember if that was an email from you maybe yesterday about Marjorie and Michael, I think, at UMKC.
That was an email from Rohit. That was an email from
me. Okay. So yes, we definitely are interested. I think I sent Kevin Truman a note a couple weeks back. I do think you're right. That's a good call out on that AR VR center at UMKC. Thank you.
So we'll need to, another note, Aaron, is that we'll need to make sure, since this is an ongoing thing for approximately a year, that we have a little time dedicated in each of our monthly meetings to do a little bit of an update on where things are.
Yep. No, it's a good call out. I think we'll continue to update on this project. We may do, we'll kind of evaluate and see if it makes sense to do a whole meeting again in the future around some of the ideas that come out and maybe some of the projects that we uncover, or may even do some more structured brainstorming work. But really appreciate everyone's joining this morning. I found this really interesting and helpful to move us along. Feel free to send any other ideas or thoughts or contacts you have to John or me via email. But I think we can probably wrap up. Thanks, everybody.
This is
going.